I'm absolutely delighted to say I'm joined by a highly esteemed London-based consultant cardiologist, Dr. Claudia Montanaro. So thank you so much, Dr. Montanaro, for joining me to talk all about heart disease and various other heart problems during pregnancy for women. So I suppose, what should women be aware of if they are pregnant, and should they get checked out for heart conditions?
So first of all, thank you very much for inviting me into this podcast. I think it's a really important question, the one that you just asked. Cardiac disease and pregnancy are very related topic. There are some people, some women who have heart disease even before getting pregnant. In that case, of course, they need to be checked. But what I see day by day is that a lot of heart issues actually are picked up during pregnancy. And this is because pregnancy is a wonderful moment of the life, but which is, and the body, during which the body is very much challenged by the increase of the volume, the hormone change. So a lot of even mild issue actually come out. So it's important for women to listen to their body, and if they have any problem, which could be, related to palpitation, dizziness, or any problem at all, then yes, they should seek for medical advice. Most of the time, things can be sorted out with simple actions. Some of the times, some more deep checks is needed.
Very interesting, Dr. Montanaro, that you say that the heart problems can be picked up during pregnancy tests or during ultrasound scans for pregnancy. That's very interesting. And it just goes to show ultrasound and various pregnancy tests can be very effective.
So usually what happens is that patient come to you or come to me and report some symptoms. Listening to what the pregnant women say and what the nature of the symptom is, I can already differentiate when there is actually a possible cardiac issue and when there is not, when it's just a symptom related to pregnancy. Indeed, to have an ECG, to have an ultrasound of the heart, of the mom heart, is the first step to see if there is any major issue. Also, it is equally very important sometimes to perform an ECG monitoring, which means, to carry a monitor. So sometimes it's like a cluster or a few dots for 12 hours or 24, or in some cases also for 7 days. So whenever a mom or future mom comes to me, I try to tailor the type of investigations based on the symptom which is complained. So as I said, often is, just they are symptoms related to pregnancy, but it's better to check because it's better to prevent problem rather than getting to the time when, a patient is and mom is in labor and find out that there is something that is not quite right.
Absolutely. Better as quick as possible to identify any problems, better for the baby and the mum, and to reduce the risks for the baby.
Sure, correct.
Absolutely. So then, leading on to our next question, then, Dr. Montanaro, how does pregnancy affect the heart and our circulatory system, especially for women?
Yeah, this is exactly what I was referring earlier on. During pregnancy, the volume of the blood increases importantly. And this is normal, right? Because the mom now has to feed another human being. So has to provide blood and nutrition and oxygen supplement for another person to be. So this is why, the blood volume increases, the peripheral resistance change. So there is a significant change in our metabolism and hormones as well. So this can lead to some of symptoms to come out. For example, there are people who are more sensitive to dehydration. So it's the right time of the life where it's really important to keep well hydrated, to drink, at least 2 liters per day. People who are very sensitive to palpitation very often experience that. And then in that case, it's very important is the experience that brings me to say, oh, yes, this is just pregnancy, or no, let's see what it is about. So, yes, a lot of changes in the body exacerbate symptoms. And it is also important to remember that symptoms not necessarily affect the baby, but equally it's very important to understand what these symptoms are underlying to make sure that delivery and the baby health is preserved.
Absolutely. And the mother can have a lot of peace of mind during pregnancy because it is a very difficult time without heart problems as well. So it is very, very important. Fantastic. Okay. And then what are the best ways then to manage heart disease during pregnancy? If somebody is diagnosed with heart disease, how can they manage that?
So if somebody knows already that has heart issue, and this heart issue can be, morphologically. So, for example, morphological. So, for example, a person who is born with congenital heart disease, or somebody with a cardiomyopathy. For example, the heart is enlarged or is thicker than what it should be, or if the person suffers from high blood pressure or high sugar level or has a previous operation, any sort of previous history should actually be investigated and considered before pregnancy. So this is a very important thing. So prevention, risk stratification, this is what then leads to a good outcome at the end of the pregnancy. Because nowadays, we know, first of all, that we can risk stratify people, okay? So we can say, your pregnancy is going to be high risk. Or we can say, despite your risk is slightly increased, if we look after you properly, you will be fine. So I think it's crucial, it's vital that people who haven't already known underlying problem actually go to the cardiologist or go to the specialist, depending on the issue, and get assessed for pregnancy. What is the risk that these things get worse during pregnancy? And I have to say that with my experience, I'm usually able to cover most range of the pre-pregnancy disease, also because I see a lot of patients with a heart problem, but also not heart-related problem, and sometimes they are coexisting. So my strong advice is to have a pre-pregnancy assessment when a person starts to build up a family, start thinking of building up a family. That is the best time. Don't wait until the last moment, but it's better to go even 1 year in advance. So you can do all your assessment, all your tests, and then you can have a smooth pregnancy.
Oh, that's fantastic, Dr. Montanaro. Very, very good advice. To actually do it a year before, so you're really, really calm and you can really focus. That's fantastic. And I think patients should be aware of when they should get checked when they're starting to plan a family. So that's fantastic. Excellent. And then, in terms of medications, then, are there any medications that women should avoid if they have heart disease during pregnancy?
Yes, this is actually a very important point, but then leads to actually it's very well connected to the idea of getting checked in advance. So all the medications that are not safe during pregnancy, and there are, can be stopped. But what is even more important is that sometimes women think that if they are taking a medication, it has to be stopped during pregnancy. And this is, again, not true. There are a lot of medications who are safe during pregnancy, and at the opposite, should not be stopped. So, again, it's very important to be seen by doctors. So, of course, medications like, ACE inhibitors, or some specific diuretics should be stopped, okay, like spironolactone. Other medication like asthma medication, beta blockers for the heart actually can be carried on and should be continued, should not be discontinued. So it's a very important topic, what medications can be carried on. And of course, again, this is part of the tailored assessment for a woman.
Fantastic. And again, very, very good reassurance for women that they can actually continue with their medications, especially their heart medications, very important for their heart disease or any heart conditions. So again, very, very good.
Correct.
Oh, always thinking.
There are some medication that needs to be stopped, but some other that can be continued. So depending on what medication the patients are, I can actually advise accordingly.
Fantastic, Dr. Montanaro. And then again, very nicely now on to our next question. How can I prevent pregnancy-related complications if I have a heart condition?
Again, if there is a heart condition underlying, the health status of the woman, the best is to assess the risk. If the risk is not prohibitive and it's safe to carry on with the pregnancy, the very important point is to have regular checks. Okay, to have a very good relationship with your doctor, to be able to feel comfortable to say and to speak to your doctor and say, I have this problem, this other problem. And it is important that the doctor who is looking after that person promptly answers to whatever symptoms is coming out. Because the successful behind a good pregnancy is assess symptoms. It's easier, to do an extra ECG, to do an extra echocardiogram, and then to give reassurance and to make sure that nothing is wrong, rather than discarding symptoms and then at the end of the day, find out that something could have been prevented or some different decision could have been made, like, for example, to deliver earlier or to add some medication that could have had the mom, because we don't have to forget that a healthy mom leads to a healthy baby. Okay, so it's very important to take care about mom symptoms and mom health.
Absolutely. Well said, Dr. Montanaro. Fantastic. And then in terms of heart disease, would you say that heart disease is the most common heart condition during pregnancy, or is there any more conditions?
I mean, there can be a variety of conditions during pregnancy, and that's why I think that if a young woman knows that has any condition, should be seen beforehand. Another thing that should be considered is also age. I mean, people over 35 should actually be checked because there are so many factors that should be considered, and also people should be counseled about offspring, children, and around age 35 and 40 and go on, there are some slightly higher risk, for example, to develop preeclampsia or the risk of congenital heart disease in children increases, or Down syndrome chance increases. To have a baby with Down syndrome increases. So there are so many considerations. And this is, of course, on top of, the usual advice that we would give to any people of any age, like do not drink, do not smoke, make sure you take folic acid before starting pregnancy. I mean, there are so many things that a woman could gain from a pre-pregnancy assessment.
Fantastic. Dr. Claudia Montanaro, thank you so, so much for this insightful insight into heart conditions during pregnancy. Thank you so, so much for your time. And if anybody listening or watching would like to contact Dr. Montanaro if they're considering having a baby, they can, get a checkup with Dr. Montanaro, and you can visit her profile at www.topdoctors.co.uk. Thank you so much, Dr. Montanaro.